A single bite from a tiny fly, and your sleep may never be the same again. Welcome to the world of sleeping sickness. As it starts like a simple fever, but ends with confusion, coma, and death. This is no ordinary disease. This is African Trypanosomiasis. Number 1. What is African Trypanosomiasis? African Trypanosomiasis, commonly known as sleeping sickness, is a parasitic disease caused by protozoa of the species Trypanosoma brucei. It is transmitted to humans through the bite of an infected TSE fly. Number 2. What are the types of African Trypanosomiasis? There are two types of African Trypanosomiasis, based on the subspecies of the parasite. First one is Trypanosoma brucei gambians, which causes a chronic form of the disease, common in West and Central Africa. It progresses slowly over months or years. Second type is Trypanosoma brucei rodescens, which causes an acute form of the disease, found in East and Southern Africa, with rapid onset and faster progression. Number 3. How is African Trypanosomiasis transmitted? The disease is transmitted through the bite of an infected TSE fly, which becomes infected after feeding on an infected human or animal. Number 4. Explain the life cycle of Trypanosoma brucei. The life cycle of Trypanosoma brucei involves two main hosts, the TSE fly, genus Glossina, and a human or animal host. First we will talk about the tsetse fly host. When a TSE fly bites an infected host, it ingests bloodstream trypamastigotes. In the fly's midgut, the parasites transform into procyclic trypamastigotes and multiply by binary fission. They then migrate to the salivary glands, where they become epimastigotes, continue to divide, and eventually transform into metacyclic trypamastigotes, the infective stage for humans. Now we will talk about the human host. During a bite, the fly injects metacyclic trypamastigotes into the human bloodstream. These transform into bloodstream trypamastigotes, which circulate, multiply, and spread throughout the body, invading blood, lymph, and eventually the central nervous system. Number 5. What are the symptoms of sleeping sickness? Sleeping sickness has two stages of symptoms. First stage is early stage, also known as hemolymphatic phase, which includes symptoms like fever, headaches, joint pain, itching, and swollen lymph nodes. Second stage is late stage, also known as neurological phase, which includes symptoms like confusion, personality changes, poor coordination, sleep disturbances, and eventually coma or death if untreated. Number 6. Why is it called sleeping sickness? It is called sleeping sickness because in the late neurological stage of the disease, the parasite invades the central nervous system, causing a disruption of the sleep-wake cycle. Patients experience extreme daytime sleepiness and insomnia at night, leading to confusion, coma, and eventually death if untreated. Number 7. Who is at risk of getting African Trypanosomiasis? People living in or traveling to rural areas of sub-Saharan Africa, especially those near woodlands, rivers, or areas where TSE flies are common, are at higher risk. Number 8. How is African Trypanosomiasis diagnosed? African Trypanosomiasis is diagnosed by detecting the parasite, Trypanosoma brucei, in body fluids such as blood, lymph node aspirates, or cerebrospinal fluid under a microscope. Number 9. What are the treatments for African Trypanosomiasis? Treatment for African Trypanosomiasis depends on the type of parasite and the stage of the disease. For Trypanosoma brucei gambians, chronic form, fexinidazole is used in early to mid stages. Pentamidine is used in the early stage and NECT, nifurtimox eflornithine combination therapy, is used in the late stage. For Trypanosoma brucei rodescens, acute form, suramin is used in the early stage and melarsoprol is used in the late stage. Early diagnosis and treatment are crucial to prevent severe complications and death. Number 10. Can African Trypanosomiasis be fatal? Yes, African Trypanosomiasis can be fatal if left untreated. As the disease progresses to the neurological stage, it affects the brain and central nervous system, leading to confusion, coma, and eventually death. Early diagnosis and treatment are crucial to prevent fatal outcomes. Number 11. Is there a vaccine for sleeping sickness? No, currently there is no vaccine available for African Trypanosomiasis. Prevention focuses on vector control and avoiding TSE fly bites. Number 12. How can African Trypanosomiasis be prevented? African Trypanosomiasis can be prevented by avoiding TSE fly bites through the use of protective clothing, insect repellents, and sleeping under insecticide-treated nets. People should also avoid areas with high TSE fly populations, such as dense vegetation near rivers. Vector control measures like fly traps and insecticide spraying, along with active screening and treatment in affected communities, are key to controlling the spread. Number 13. Is African Trypanosomiasis a neglected tropical disease? Yes, African Trypanosomiasis is classified as a neglected tropical disease by the World Health Organization. It primarily affects poor and rural populations in sub-Saharan Africa and has historically received limited attention and resources. However, with ongoing control efforts, the number of cases has significantly declined, and elimination as a public health problem is now considered achievable. Number 14. Can animals get African Trypanosomiasis? Yes, animals can get African Trypanosomiasis, especially livestock such as cattle, pigs, and goats. In animals, the disease is known as nagna, and it causes symptoms like fever, weakness, weight loss, and reduced productivity. It has a major impact on agriculture and the economy in affected regions of Africa. Number 15. What is the current status of sleeping sickness control? Sleeping sickness control has made remarkable progress, with annual cases dropping from nearly 40,000 in 1998 to fewer than 1,000 in recent years. In 2024, Chad was recognized by WHO for eliminating it as a public health problem. The goal is to eliminate transmission of T. Brucei gambians by 2030, but challenges like asymptomatic carriers remain. Continued surveillance, treatment, and vector control are essential to sustain this progress. Sleeping sickness may begin with a bite, but it ends with awareness. Let's keep the fight alive, one view, one share, one voice at a time. If you found this video helpful, don't forget to like, share, and subscribe to Tiny Predators for more on the unseen enemies around us.